Senator Husted.
Thank you, Mr. Chairman. Doctor, thank you for joining us today. I enjoyed our visit and conversation.
Senator Husted, can I ask you to pause for a second, pause the time? Senator Hassan, did you want to put something in the record?
Yes, I ask for unanimous consent to submit for the record an article from the New York Times.
Without objection, and thank my staff for picking up our.
Thank you.
Senator Husted.
Thank you, Mr. Chairman. So when we visited, we discussed the role of the CDC in restoring trust in the CDC post-pandemic and some of the very troubling recommendations that came out. I think that the public helped sow the seeds of distrust. And we also talked about the costs of healthcare, that in the 21st century, it's the sector of the economy that is most inflationary, and how technology can drive down costs, which in healthcare, it's largely driven up costs so far. But we also, in driving down those costs, want to maintain the quality and a wonderful healthcare system we have in this country. You, when you were deputy director, were very involved in research projects related to technology and AI, I believe. And I've been visiting with some healthcare professionals recently, and one of them discussed an AI chatbot that they said would serve, if anyone talked to this AI chatbot, it would give them better advice than any doctor could on a variety of topics, not on a specific topic, but on a broad variety of topics, because nobody could know as much as this chatbot had available to it. So under the idea of technology improving quality, technology driving down costs, but also trust, just what thoughts do you have on these new technologies and how they can improve healthcare for people in America?
Yeah, it's a super important question. I think, as I've evaluated the development of these AI-enabled technologies, the first thing you have to be able to do before you acquire a technology or you put it into your workflows is understand the problems you're trying to solve. What is it that this AI technology is going to enable that has not been able to be completed before with other mechanisms of workforce? And when you're able to clearly define the problem you're trying to solve, it allows you to evaluate these different technologies to make sure that you're putting in the right technology is fit for purpose. Once you put a technology in place that you have evaluated and you want to incorporate it into your healthcare workflows, it has to be monitored. It is not one of those issues where you put in an AI-enabled technology and then you walk away. It will need constant evaluation to make sure that the training data that was used in this AI technology stays consistent with the evolution of your organization, an evolution of the patients that you're serving, and the evolution of the potential therapeutic interventions that you seek to provide. So these AI technologies can be incredibly valuable, and they can incorporate and retain information that well exceeds a single human's ability to interface with a particular challenge, but it needs to be done in a disciplined way because you can create better outcomes, but you also have to make sure that you're mitigating any risks about having these technologies incorporated without the right safeguards.
Yeah, the safeguards seem incredibly important because while this can be an amazing enhancement to healthcare, it could also, in the wrong hands, be used to manipulate people to do unhealthy things. And so we'll just have to continue to work.
I look forward to working with you on this. Yeah. I have a lot of experience in evaluating these technologies, and I'm happy to work with you.
So one role of the CDC is you're looking around the corner. We're going to prevent the next pandemic? What are we going to do? But also there are health challenges that sit right there in front of us every day that we don't address, and as I talk to a lot of experts, they keep telling me, look, it's what we eat, it's what we're putting in our bodies that are causing much of our healthcare costs and healthcare problems. I continue to just can't believe that we have a SNAP program where we literally subsidize people to eat things we know are killing them. And so what role do you play in helping America get healthier by what we do to ourselves?
Yeah, so it's such an important question. So CDC is going to refocus its mission specifically on those communicable diseases, but if I'm confirmed as the CDC director, I look forward to supporting the secretary as he continues to prioritize these other urgent public health threats, and I also look forward to supporting the secretary in transitioning any of the critical programs that CDC has been overseeing to other parts of the agency, because as you highlight, there are existing threats right in front of us in terms of making sure that our food supply is adequate and is healthy and is available to our children, making sure that children value the exercise and physical activity, and making sure they're staying healthy and they have access to healthy water and environments. These are all very, very important issues, and I look forward to continuing to support the Secretary on it. And if I'm confirmed, I look forward to working with you.
Great. Look forward to supporting you. Thank you, Mr. Chairman.